So, what is epilepsy? I'm sure most of us have seen someone who is walking normally on the street, and then suddenly they fall down and have this very violent movement of the hands and the legs, and then they can pass urine. They pass some stool sometimes. So this is the typical common presentation of someone who's having a seizure or an epileptic attack. But as we're going to see later on in the videos, this is not the only way in which a seizure or in which someone who has epilepsy can present. They can present in different ways, and we'll see that later on as we go. So we know that the brain controls movement in the body and all the other functions. So if you want to move your hand, that part of the brain which is responsible for movement of the hand will be stimulated. And this stimulation is in form of some very minimal electrical stimulation in the brain. And if you want to move your leg, that part of the brain that is responsible for movement of the leg will be stimulated. And this stimulation you can control because you want to move the hand, so you move the hand. But in someone who's having a seizure or having epilepsy or who has epilepsy, what happens is that you get this abnormal stimulation of different parts of the brain. And if this is a part of the brain that is responsible for movement, you'll get abnormal stimulation of that part of the brain, which will cause abnormal movements in the hand or in the leg. And these movements, you'll not be able to control them on your own because this is abnormal stimulation in the brain. You don't have control over it. But after a few seconds or after a few minutes, it will stop on its own. So if only one part of the brain is being affected, then the person will present with just abnormal shaking of the hand or abnormal shaking of the leg, which will stop on its own. But if both sides of the brain are being affected, you get the movement, abnormal movement, and shaking, violent movements on both the hands and the legs on both sides. And these are the patients we see who fall down, they pass urine and pass stool. Okay, so if this happens once in your life, you don't have epilepsy, you just had a seizure. Okay, but for you to call it epilepsy, this has to happen more than once over a few days, a few weeks, or a few months. Then you can say someone has epilepsy. So remember, if someone has one seizure, we don't call it epilepsy. We only call it epilepsy if it has happened more than once over a few days, a few weeks, or a few months. Okay, so now that we know what epilepsy is, or what causes these abnormal movements in the brain, it's not spiritual, it's not demons, it's not a curse, all right? It's just abnormal stimulation in the brain causing these abnormal movements that you see on the body.